think she's, what, 28, 29, something like that?
Yeah, they're very close.
Yeah,
Not
somewhere
30
in
yet.
there. Yeah.
We have a caller on the phone already, so let's get to it. Cher
On the radio.
of Elk City. She's
Yes.
wanting to say something. Yes, what do you want to tell Harold?
Hi, Mr. Wright. I am always so pleased to hear you on the radio, and I appreciate you taking the time to speak with us. It's, I know you're going to be retiring soon, and it just reminded me, excuse me, it just reminded me of a young boy clomping around the house in his daddy's boots. I hope that we find this representative as good as you are.
Ah.
You guys
Well,
have a
thank you. That's
wonderful
very nice.
day.
Thank you.
Yeah, I thought that was kind of cute, was clomping around the house.
That's
Yeah.
very sweet. What a
Yeah.
wonderful message.
Yeah.
Thank you very much, Cher.
You're welcome, darlings. Have a wonderful day.
You
Bye.
too. Bye-bye.
There you go. See, look at that. Already starting off on a positive note. If you have a question and want to talk to State Representative Harold Wright, 580-772-9700. I don't know why I was struggling there. 772-9700. We'll talk about all kinds of things. I saw you guys were in session, which was a big deal. And kind of, I would like to just kind of be curious to hear about how you did it. I mean, I know you said you never had more than 10 people on the floor at a time, and we'll talk about that, how you were able to vote on things. And then also the status of the rainy day fund we can talk about. I know there's several $100 million kind of going different directions as we came up in a shortfall, but then we also were trying to plan for this emergency management as well. So we'll kind of talk about those things this morning, and anything else you have on your mind.
Well, just talk a little bit about the fact that, we were kind of trying to see where we're going to go with our budget. The governor has now decided he wants to cut this year's budget. So we'll talk about that this morning.
Very nice. And also want to remind you, Lucille's Roadhouse sponsoring Conversation Corner, and they want to let everyone know they've extended their hours to 8.
Oh.
So now they're open till 8. And then also, of course, we always say while supplies last. This one is a crazy one.
How crazy.
It is 2 burgers, 2 fries for $10 at Lucille's Roadhouse. Carry out with the car hops.
Coyote Mornings with Van and John.
ASAP General Stores wants to help you solve a lot of the problems you may be faced with during this hard time, like helping you save up to 25 cents per gallon on your gas by using the Phillips 66 app on your phone. You can come by and pick up a fresh breakfast, lunch, or dinner and get many of your favorite beverages, as well as carrying a lot of the everyday items you may run out of around the house. ASAP General Stores in Weatherford, Clinton, Hinton, and Thomas are open and ready to serve you and your family. Get there ASAP.
Napa know-how.
It's time for the famous annual tool and filter sale at Napa of Elk City. It's all happening April 27th through May 9th. Get 20% off everything that's not already on sale. Up to 50% off Napa tools and filters, and 50% or more off on select Evercraft tools while supplies last. Napa is open in-store, but they're also offering curbside service and free delivery for your convenience. It's all happening April 27th through May 9th. The big tool and filter sale at Napa of Elk City.
Napa know-how.
When it comes to cooking meals, drying clothes, heating water, and my home, nothing beats natural gas from CenterPoint Energy. It's my most affordable option. Plus, there are no peak charges, while electric rates can spike during peak hours. So, if you already have natural gas, keep it. But if you're replacing an appliance, choose it.
To learn more about enjoying the benefits of a natural gas home, visit centerpointenergy.com/natural gas benefits. CenterPoint Energy. Always there.
Your kitchen is the focal point of your home, and Toutfest Home Design Center can help you with your dream kitchen, whether you're a new build or remodeling. We have access to nearly all of the designer and commercial appliance lines, and we have a kitchen design consultant on staff. You'll be pleasantly surprised with our competitive builder pricing and the follow-through of our sales staff. And always service after the sale. Toutfest, the best in quality, service, and price in downtown Weatherford.
It's time to enroll with Air Medcare Network. Members have no out-of-pocket expense related to a flight for a life or limb-threatening medical emergency on any of our 320 providers across 38 states, including AirEvac Life Team in Kingfisher and Weatherford. When every second counts, you can get your family peace of mind by enrolling with Air Medcare Network. Just $85 annually covers everyone in your home. Ask about available discounts. Call Christy Hatfield for info and to enroll today at 580-878-1002.
Hello, this is Dr. Kathy Fox.
And I'm Dr. Danny Fox.
After 35 years in dentistry, we know that many people are fearful of dental treatment because of bad experiences when they were younger. Fortunately, things have changed in dentistry.
That's right. Now we have techniques to help ease our patients' fears and better materials and equipment so that we can give the best treatment with very little discomfort.
It's time to stop letting your health go because of fear of dental treatment. Come get to know us, or better yet, ask our patients.
Call us at Fox & Fox Dentistry in Elk City at 225-6011. That's 225-6011.
There's a lot going on in the world right now, but getting your tax refund is as important as ever. H&R Block is here to help you safely get your taxes done. Just drop off your documents at H&R Block and a tax pro will do the rest. Call your local H&R Block office today.
This is Ryan Willis in Weatherford.
Tanya Willis in Clinton. And Carissa Willis in Elk City in your locally owned H&R Block offices. Walk in, make an appointment, or drop off your docs, and we'll tackle your taxes while you're away.
What prompted me to call the helpline was talking to my son. He was like, the smoke is bothering me.
When you call the Oklahoma Tobacco Helpline, you're going to get free help from a Quit Coach. We don't judge anybody who calls in.
The Quit Coaches were very understanding, not at all judgmental.
You need somebody who's understanding, somebody who can really help you in those difficult moments without judging you.
The Oklahoma Tobacco Helpline was a vital part of my quitting.
For free help, including text and email support, call 1-800-QUIT-NOW, a program of TSET.
Coyote Country 95.5 with Van and John.
State Representative Harold Wright is our guest this morning, and every Thursday while in session, the last time, your very last few days here. And what a weird one to finish it off with, too. So limited.
Yeah, it's been very interesting, kind of strange. We didn't expect this at all, coming into the session in February. It just didn't look like that this COVID-19 would be doing as much as it has to become a pandemic. They were still wondering at that particular point. They'd say it might be, but it just all of a sudden fell into place back about a month ago now.
Yeah, it's crazy. We have more than China had. That's somehow, I feel like that was deceiving to us because there were so many people there. And so you think, well, that's not a big amount for as many people that are there. But we forget that they.
I don't think that they didn't report all of their cases. That's the problem. They just didn't report as many because they didn't test as many.
Mm-hmm.
Right. I think that definitely kind of helps out. So let's talk about the state of Oklahoma. I know you mentioned because originally we'd come out, I thought, and said, hey, there's a shortfall. Let's use the rainy day fund. We're not going to make any cuts this year. We'll get this year out. And we'll start working on, or you've been working on, but finishing up next year's budget. So are you telling me there's kind of a change there?
Well, the governor is wanting to cut the budget this year now, about 1% to 2% for the year. However, the problem with that is that we've only got 2 to 3 months of this year left, which means it's about a 25% cut to state agencies. And so that's going to be pretty tough because you take the 1% out, basically in 2 or 3 months, and that's a killer. So I think that'd be a big mistake. What happened on Monday, we came in and we voted for a resolution which gave the governor additional emergency powers for just a limited period of time, just for 30 days. And then we passed 3 bills for the budget, basically taking money out of the rainy day fund and putting it into a place where we could use it once the Board of Equalization declares a revenue failure. Now, they've not done that yet. And the governor has said, at least early in the week, he's wanting cuts. He after the House passed the bills on Monday, he went around us. The Senate tried to get them to not pass the bills, but we had an agreement, so they passed them anyway. And now the governor's trying to, do something different by cutting the budget. And we were trying to get this year's budget done first, the 2020 budget, because it's over in the 1st of July. So we'll see what happens. I mean, I'm not for that. I think that'd be a mistake. Our economy is teetering a little bit in Western Oklahoma, particularly. This would make it more difficult, I think, if we cut the budget by more than 25% for this year, the next 2 or 3 months. So I'm not for that. Neither our members, most of the members of the House, we voted. Every member of the House, including Democrats, voted to do these bills. So I think that's a good sign of solidarity. to keep things going in our state this year. And then we'll take a look at next year. We're hoping that we can keep next year's budget flat, but there's, I don't know. The governor's also wanting to cut next year's budget as well. So we're going to be in some negotiations trying to get that stuff out. We had it pretty close to finishing up our budget a couple of weeks ago. Then this whole deal got worse, basically. We went from a $200 million hole this year to $400 million hole, and we still don't know what that's going to be like next year.
Yeah, I think that's my question. So how much money, let's start with this. How much money was in the rainy day fund?
Well, there was about a little over $600 million, plus we had some other money in contingency. So we had about $1.1 billion total in contingency money, including the rainy day fund.
Because that's my question, I guess. We if we have to send over $200 million or $400 million, and then also preparing for next year as well, is there a chance that if we run a flat budget, we'll have to, for the second year in a row, use the rainy day fund to solidify funding towards the end of the session?
Not this year. Not this year. I mean, but for next year's budget,
right.
We're going to have to do some additional rainy day funds. Yes.
And so I guess, yeah, I mean, I see. I mean, I'm not trying to say the governor's right by any means, but I definitely see his point of, hey, we're going down right now. We need to start making cuts. But then when you start making cuts, it's people's jobs and then services are affected. I don't know the right answer, and maybe you do.
Well, I think the thing that I'm for is let's get this year's budget done, the 2020 budget done, and then we'll have until end of May to get next year's budget done, and we'll see where we are. It's still going to be a moving target. We have the information from the Board of Equalization, and so let's do it that way. I think that's the best way. I agree with you, that we're going to have to hold our purse strings pretty tight, but there will be some federal dollars coming in for this next year's budget that we don't have for this year because of the coronavirus to help state governments. And we know that. We know there's going to be some supplemental revenue from the feds. So, you're just trying to come out and balance the budget the best you can and provide for those what we call core services for the state of Oklahoma. And that includes a big part of that's education.
Do you see you guys extending your what's it called? Special legislation or special session? Yeah.
No, I don't. When you call a special session, the governor called it for specific purpose, and we've already done that,
right,
which was to give him some additional emergency powers. We don't plan to go into special session. We hope to get the budget done by the end of May. We will do that one way or the other.
Right.
We've got provisions. You were asking earlier on. It's kind of interesting. This is historic in the state of Oklahoma to have the special session to call the emergency, to give the governor the emergency powers, which that law did not go into effect until early 2000. And so that's when that legislation was written after 9/11 to give the governor extended powers in case of a plague, or I don't think they even thought of it being a plague. It was more related to 9/11, which at that point would have been something happening in a different way, like the bombing, the Murrah bombing, or maybe 9/11 where the airplanes ran into. They weren't even thinking about a plague for using it for that at that time, but that law was enacted after 9/11, and then the governor enacted that or requested that. So the bottom line to your question is we're not going to most likely going to have a special session this year because part of the reason is that the building, the Capitol building, is still being worked on. So, we would have to make some provisions to meet somewhere else if we did that.
That makes sense. Well, so what's it been like? I mean, with the whole, because you guys you're all there, but you're not all on the floor at the same time, or how's this working?
Well, it was a very unique experience. I don't know if some of you saw pictures from the day, but I was on the floor as the presiding officer. We called a special session. We had the floor leader and the majority and the minority floor leader, John Eccles and Emily Virgin, on the floor with me, plus the parliamentarians. So there were just four of us on the floor at one time then as we got we called the roll. Members were all in their offices, and so we also allowed in this emergency a special rule to allow some members to vote by proxy. So basically, it took us about, I'd say, an hour to pass one bill because we had to allow all the members in groups to come on the floor and vote and then leave immediately so that no more than 10 people were on the floor at one time.
Oh, wow.
So that, in order to abide by that rule, we have 101 members. So it took a little while to get everybody out of their offices, onto the floor, and leave the floor and vote. And it worked pretty well.
No, it sounds like it. Hey, you were able to get it passed, right? So that's what really matters.
Well, the first resolution took longer. There were a lot of questions about it from the minority as well as some of our majority members. And so on the other three bills, we didn't have many questions, so it moved along a little quicker. But we also learned how to vote faster. We had members waiting towards the back of the chamber in the anteroom and in groups, less than 10. And then as one group left, another group came on. So we got a little faster as the day went on, but we never had more than 10 people on the floor at one time.
Have you heard anything from your constituents about the shelter in place and saying that the governor needs to be more, do more, or do you think people are pretty satisfied?
I've had both ways, actually. It's not an easy decision. I've had some members, frankly, some of my constituents have written and called and said that we've gone too far. We should allow a little bit more flexibility out here in this part of the state. I've had other people, though, from Weatherford and around the state email me wanting us to go into shelter in place and have stricter rules. Now, here's the way I understand it. We're not that much different than shelter in place anyway. It's just that supposedly everything is closed down, but there's still some essential services open even in shelter in place. So, I think we're doing a pretty good job. For example, in Custer County, we started out with the 5 cases, and that's still all we have in Custer County. We just don't have as many people out here, so you don't have the contact like you have but in the bigger cities. Now, Oklahoma City and Tulsa they are considered shelter in place. They have taken that extra step. Norman has, some other places have as well. They're saying, well, the whole state needs to be that way. So I've been getting a mixed bag on that. I've been getting constituents saying that we need to go both ways. I got a very long text last night from a friend who's in business and also a doctor, and he believes that if we don't turn this thing around pretty quick, and he's in business as well as being a doctor, and he says we're doing the right thing. We just need to get back as before, or at least by 1st of May, towards the end of April, and get our economy going again, because it's going to be very harmful to people. You start reaching a point where the medicine starts to have a negative effect on the outcome at some point. And that's sort of where we may be if we don't get our economy rolling again sometime after the 1st of May.
That makes sense.
That makes sense.
Yeah, no, it makes sense.
There's a real balancing act there, and the governor has left it up to the cities to do what they want to do and go a little further. But there's not that much difference in what we're doing now in the shelter in place. It's very, very, very small difference. And people are still supposed to have social distancing. I'm seeing more and more people wearing, the CDC is asking everybody in the country to wear the mask when they're out. That doesn't really help the person wearing the mask as much as it protects. If you're what they, what they call it, asthmatic. I'm not getting that word right.
Asthmatic, is that asthmatic?
Asthmatic, yeah.
We're learning all kinds of words. Unprecedented, asthmatic.
Anyway, what that means is basically you can carry this for a few days without actually showing symptoms.
Right.
And if you've been exposed, you may be carrying it, so you got to be careful when you're out and make sure that you don't sneeze on somebody, because those droplets go about 10 feet. And and they stay on a hard surface for 12 hours. And there's a big difference between this coronavirus and a regular cold, and you need to know the difference.
Are you wearing a mask out in public?
I have, yeah, some.
I called my dad and tried to talk to him about staying inside, and he said his argument was that or staying at home, not inside, but staying at home. And his argument was about the droplets going 10 feet. But he lives out in the country, so that wasn't a really good argument for me, I'm like, he's like, I could get it just being outside my house. And I'm like, well, not really, because you live out in the country. So it's not very easy for, droplets to get to you 10 feet away. So I don't know. We find that we're having trouble getting people to stay Some people taking it very seriously, wiping down every single grocery item that you brought to them. They did not go shopping themselves. And then some people, like my dad, just thinking he's taking it seriously, but not really. Still going to the store when my brother could go for him and those kind of things.
Yes, and I think that's where you need to look out for yourself, and also try to look out for other people at the same time. When I wear a mask is when I'm in groups. Like I was out yesterday walking around town, and I'm not close to anybody. I'm just out walking. I'm not wearing a mask in those situations.
I had a friend call you, a woman from my church. She had a horrible tragedy happen. Her son was found dead in his apartment. He'd been sick for a few days, and they were worried that he might have COVID-19, but the medical examiner is not wanting to, as far as I know, the last time we heard about it, not wanting to test that since he did pass away. And they even did a news story on it. They had it on Channel 4. Did you make any progress with that, or what was the experience with that?
Yeah, I did talk with that person. She's a constituent of mine here in Weatherford, and that's a sad story. I mean, to lose anybody during this time has just got to be terrible. I found out this week I lost a cousin of mine who passed away, not from the COVID virus, but she passed away this week. She'd been ill for some time, and so it's just hard on families when you lose someone, because you can't really have a funeral. If you do, it's got to be very small, 10 or less, and so a lot of people are doing what my cousin's husband did, and that is they're cremating the body, and then they're going to have a place in their church, what they call a columbarium. That's a new word for you. How's that? Asystematic columbarium.
Columbarium.
Now,
Wow.
You know what a columbarium is?
No, I'm trying to use context clues. I'm assuming it's a place that holds urns, but
yeah, it's an area usually dedicated, like in the front of a church, for to insert the ashes. It's just very small, and I've seen those, and some churches do that. So that's what their plan is, to have a service later on.
Hey, speaking of, this is completely unrelated, and I don't even know how to jump from one train. This is called the Train Wrecking Radio, but did you have a chance to watch your man's, Mr. Mike Gundy's press conference the other day?
Mm-hmm.
Yeah, I saw that, a little bit of it. He's been criticized nationally for that, obviously.
Right.
And I think the bad thing is, I think a lot of that was taken out of context.
Yes.
I heard that part of it. And, all he's basically saying is he hopes he can get back to, that maybe by the 1st of May they can test these kids and get them back there. And if I was him, I'd be pretty worried. I mean, their jobs are on the line no matter what. And so I don't know that I would have said it exactly the way he did. It's just like President Trump. Sometimes I don't think I would say things the way he says things either.
Right.
Because when you're in a high-profile position, it can come across wrong.
We saw SWASU, of course, announced a couple days ago that they are moving their summer classes will be completely online as well,
right?
To get through. Do you think, in your honest opinion, that we'll be back to normal, especially when it comes to college and things of that nature, by the fall?
I think so. Yeah, I do. I think that we're doing better right now nationally than what we thought. I mean, this right now, this week and next week are supposed to be the worst weeks. And we are recording more deaths, like in New York City, than we have ever. So, just kind of depends on what happens in the next couple of weeks. But I'm seeing some good things. The curve is starting to flatten around the country in different places, particularly. And so hoping that that this 30-day moratorium that we've had will end. When it ends, hopefully we can start seeing things open up again.
We have a question from a listener asking about the rumor, I guess, that the Indian hospital doesn't have to report their positive cases because they're a federal agency. Is that really true?
I don't know. I'd have to check into that. That doesn't make sense to me because, they would, I think, have to report them to CDC, maybe not to the State Health Department. Maybe that's where the difference is, because they're not a part of the Oklahoma Health Department, and the Oklahoma Health Department has no control over a federal facility like that. So it may be, and I'm just guessing at this point, it may be that they don't have to report it to the state health department, but they do have to report it to the CDC. But I'm not sure about that. I could find out.
All right. Well,
I can find out.
If somebody wants to get a hold of you, how can they do that?
They call me at my office, leave me a message. It's 405-557-7325. Or call me on my cell phone, which is 580-774-7713.
Very nice. Well, if you get that answer about the Clinton Indian Hospital or any of the Indian hospitals, I guess, but this is coming from Clinton, then let me know and I'll relay that message to that person asking.
Yeah, there are a number of facilities that are operated by tribes as well, and I'm sure they're sovereign nations. I would say that the same would be true of those as well, because they're not under the state government in that way. So I would think in a cooperative effort, though, they'd want to do that.
Yes.
But they may not be able to. I don't know. I'll find out.
Well, thank you very much for chatting with us, State Representative Harold Wright. And don't forget, for folks that are listening, today at Lucille's, 2 burgers, 2 fries for only $10. Have a good day, Harold.
Bye. See you later.